this module, we will discuss the common features of the psychosocial model. While understanding the mental health psychosocial model is necessary, implementing the approach is crucial to create effective forms of support and health systems that are reliable and sustainable. The psychosocial model can be applied broadly in different contexts. While each application will be adapted to the needs and the realities of the context, there are clear features that remain common to all the applications of the model. These features represent key aspects of the model that contribute to a comprehensive and holistic understanding of mental health and well-being. Overall, this holistic approach contributes to a more effective, person-centered, and culturally sensitive mental health care and supports efforts to create environments that promote mental well-being and prevent mental health issues. In these next few minutes, we will go over some of these different common features. The first is respect for the human rights of the individual. To promote genuine mental health and well-being, it is essential for a human rights-based approach to be adopted. That is person-centered and also based on recovery. A rights-based approach to mental health calls for equal access to quality care and support that is holistic and consensual. The right to give or withhold consent to treatment is included in this. The UNCRPD Committee and the UN Special Rapporteurs have explicitly referred to forced hospitalization and treatment as violations of basic human rights. The human rights imperative of participation often translates into co-creation in mental health and has shown that it can lead to successful, tailor-made solutions providing quality support and respect for human rights. The UNCRPD also prohibits discrimination against people with mental health problems, which is relevant also in areas outside of the healthcare sector. The next is equal partnership. Policies, legislations, and societal norms often further marginalize those with psychosocial disabilities or mental health problems, fueling discrimination. The UNCRPD and thus the psychosocial approach can help dismantle this by fostering equal partnership and shifting the focus to the social barriers, which prevents people from participating in society on an equal basis with others. Providing mental health support should be based on an equal partnership. For example, consulting and talking with the person requiring help, and in some cases their families or wider community, about what types of support are available that could be appropriate and helpful. The relationship between the person experiencing distress and the person or people supporting them, this can be, for example, an advocate, friend, employer, physician, psychologist, and therapist. This should be in partnership of equals with supporters who do not seek to control, but rather to stand with or alongside the person. An equal partnership supports achieving equity in mental health care and in providing care that reflects the needs of the individual. Beyond the healthcare sector, having an equal partnership facilitates personal agency and ensures people are provided the space they need in the community to find psychosocial solutions rather than being disempowered. This approach also further reaffirms that all persons with disabilities, including persons with psychosocial disabilities, are right holders and equal participants in society. The next common factor looks at personal goals and outcomes in the journey towards recovery, being self-determined. Self-determination and agency refers to each person's ability to make choices and manage their own life. In essence, this impacts a person's mental health, as self-determination allows people to feel that they have control over their choices and lives. Mental health systems should encompass and encourage self-determined and personalized support for people experiencing mental health problems. Person-centered approaches can ensure more tailored and effective care as we know that distress is caused by a wide variety of factors as explained above. This is essential, as renewal of self-determination is a critical part of recovery from mental health challenges. The promotion of self-determination can include providing access to reliable information on rights, mental health support, support from peers, how to connect with others who may be experiencing the same challenges or have lived experience of mental health problems or psychosocial disability. And this, for example, can include support networks, self-help groups, social inclusion initiatives, support in independent living, education and employment, and space to experience with various interventions and recovery strategies. The next common feature is involving communities. The involvement of social, family, and community networks to which an individual belongs is a well-recognized approach to effectively promoting mental health, preventing mental health problems, and designing tailored mental health solutions. This allows for an individual to draw on existing and build new support structures, family relationships, and ties to the community, rather than relying on institutional support. This can lead to the person having control over difficult situations with the right support. Moreover, communities have a central role in preventing and tackling mental health stigma. Today, community-based services are considered a backbone of the rights-based services that should promote holistic recovery approaches and the right to legal capacity, informed consent, participation, and community inclusion. Many are renowned for being human rights compliant, accessible, affordable, and of high quality, although attention must be paid not to mistake small-scale institutional care for community services. Intrinsically, community care can succeed in maintaining family relationships, friendships, and employment based on the person's own preferences while receiving mental health care or social support. This is a big contrast to the biomedical interventions where there is an over-reliance and over-prescription of medication as a first, only, or often long-term response. Moving on now to recognizing lived experiences and valuing support by peers. Respecting human rights in mental health care and practices requires a person-centered approach based on each person's unique identities and lived experiences. As such, people with lived experiences of mental health problems or experts by experience should be recognized as experts in their own experience and contribute to shaping mental health outcomes, better mental health outcomes. This term refers to persons with lived experience who have gained expertise in their own experiences and the mental health system. They often speak out and advocate for the rights of their peers, providing space for diversity of voices of persons and groups with lived experiences can aid in understanding where there are critical challenges and gaps in mental health care and support. Reforms and adaptations of mental health care system and practices and of policies in sectors that impact mental health. Some of these sectors, for example, include employment, education, and housing, should be influenced by those with lived experience through meaningful dialogue and engagement, as they are best placed to propose appropriate solutions. In some cases, reasons for inadequate uptake of psychosocial model may be due to the lack of consideration of the practical realities or lived experiences of those concerned. Therefore, drawing on the expertise of people with lived experience and their supporters and actively involving them in the design, development, monitoring, and evaluation of mental health practices and services is necessary to successfully achieve the shift in paradigm from a biomedical to a psychosocial model. Peer involvement in the provision of mental health support is vital for transforming mental health systems, as people with lived experience bring understanding, resilience, and trust to services. Peer support can help individuals to achieve and maintain wellness and to navigate the social and mental health system more effectively. Depending on the country context, peer involvement may take many different forms, from peer support specialists to independent peer-run services. Peer support can also be effective in increasing mental health awareness through education whilst tackling harmful social norms. The next common feature is aiming for hopeful narratives. There is no single solution to mental health support and care, and recovery is part of a normal human process. Fostering more hopeful narratives in mental health is essential for promoting individual well-being, empowerment and agency, reducing stigma, building resilient communities, and influencing positive systemic change. By emphasizing testimonies of hope, recovery, and strength, society can contribute to a more supportive, positive, and inclusive understanding of mental health. The last common feature to share is holistic practices. Holistic psychosocial services are essential to fully address the social, personal, and psychological needs of individuals, as well as to promote the prevention of mental health problems. Holistic care includes involving multidisciplinary teams and promoting psychosocial rather than medical solutions. This can include working with or signposting to experts with various skills to support the mental health and well-being of individuals. In addition, this can also involve working closely with other departments and sectors to gain support to address social factors that may impact a person's mental health, such as housing. To do this, adequate referral pathways and cooperation between services are critical. Naturally, such systems that apply the psychosocial approach allow for individuals to receive and access services tailored to their unique and complex needs. A holistic mental health in all policies approach can also promote good mental health, prevent mental health issues, and ultimately lower stigma and discrimination and create resilient communities. States also need to be more flexible financing systems to achieve a holistic intersectoral approach to mental health. In this next module, we will hear directly from stakeholders who will share what they do in their work in line with the psychosocial approach to mental health.